The battle against AIDS right here in Cleveland.
Strike!
A state champion bowler. One of many accomplishments for 20-year-old Lawrence Stallworth. College-bound and so excited about his future.
I take good care of myself. If you ask my doctors, I'm in amazing health. You'd be surprised, I'm probably healthier than you.
And with that, what's really surprising to learn, this young, ambitious, loving life man is HIV positive, infected at 17, devastated at first, but gained control quickly.
I'm a lot more than that. HIV does not define me. It is just simply a part of my life. You can get to know me. I would like that versus you judge me based on one little thing.
He's an example of how far we've come with the HIV/AIDS virus. With the latest medication, for some patients just one pill, adding decades of quality life where there used to be only a death sentence. It's part of why we don't hear about HIV and AIDS as much as we used to, but
I was wondering if maybe you could call this patient.
It's still very present and can still destroy lives, keeping the Cleveland Clinic's infectious disease department very busy. Specialist Dr. Kristen England.
Good morning. How are you today?
Gets new patients weekly.
You need to see that face. You need to make sure that they understand what you've just told them, the importance of what you've just told them, and that they need to be able to have all their questions answered right then and there.
The number of those infected in our area, around 3,000 in Cleveland, 4,000 for Cuyahoga County, been holding steady for years. That means for as many who die from it, others are newly infected. Well, that's hard to hear. Many believe if it weren't for the controversial needle exchange program, the number of HIV infected in Cleveland would be much higher. It's run by the Cleveland Free Clinic. Pretty simple. Out of this small van, set up in a couple of places in the city a couple times a day. Allows anyone who uses needles for any reason to get rid of the used and receive new. No charge, no questions asked. And the idea, no more spreading of HIV this way, making the #1 mode of transmission, without question, sex, with the spread at its worst right now among the young black gay male population.
It's disheartening because we've done a lot of work.
The director of the Greater Cleveland AIDS Task Force pleased with the progress she's seen over a couple decades, but not understanding why there's not more, especially when it comes to stigma.
If you tell someone that you have diabetes or you have heart disease, usually people will say, "Oh my God, let me give you a hug. Are you okay?" If you tell someone that you have HIV, people tend to shy away from you, and the first question they ask is, "How did you get it?"
So you have support groups.
With that, the task force offering all kinds of services for the infected and affected, the family and friends. 15,000 people a year finding this their safe haven. It's where people like Lawrence find their strength, but still the world awaits the big find, a vaccine. Cleveland's own Case Western Reserve University, one of the most elite centers in the world, leading the charge, believing the miracle drug is at least 10 years off. With $20 million worth of research a year, clearly, though, the hope is as here and now as ever.
If I had to quit my job as an HIV physician, that would be the best day in the world.
Catherine Bosley, 19 Action News.